I'm telling you, back then when I tell people, and people be like, "Well, you're HR, so you should know." I'm like, I know what to do, but I'm just this small girl that wants to fight big people. When I got here, I wanted to continue in that light. But I saw that, yes, there are organizations out there that support people living with HIV, right?
There's this place in Calgary downtown where there's like free food and free stuff that people can get. When Black people do go, it's they're covered because so people will now see me going to this shelter to collect food. Like there's this like the pride. Hey, will you eat your pride? You need food. Please go and collect food. Hi everyone, welcome to another episode of Afros in the Diaspora. And on this episode we have a very, very, very special guest with us today. Her name is Miriam Abimbola Lawal. She is a human resource manager, community advocate, and the founder of AfroCare Support Network, a volunteer-run nonprofit empowering African, Caribbean, and Black communities through health advocacy and education. Okay, she is known for her compassionate leadership and creative flair. As you can see with that filler that is on her head like this. So we have Miriam. How are you?
I'm fine, thank you. How are you, Sarah? Thank you for having me.
Look, I'm very excited for this episode. I think we're about to get into the nitty-gritty because I've seen in Calgary in the community, I've seen a little bit about AfroCare Support Network, and I can't wait for us to dive into, what this beautiful, beautiful platform and community you've created is. I think it's just incredible work that you're doing. And yeah, I can't wait. I cannot wait. But
let's dive into
it. You know what we are. You know now. You know. We're going to get into the trivia. We're going to ask you about your fatherland and your motherland. You know. Okay.
I'll try my best.
We have faith in you. You got this.
May my ancestors guide me.
They will guide you. See, you see that your lovely filler like this. It's communicating directly with them. So they are just downloading knowledge. Understand? It's just
my ancestors are here.
Yes.
They'll provide the answers. So let's go. I'm ready. I'm ready to
check. Are you sure you're ready? We're going to start easy. I'm going to do my best to be a good host today.
Yes. Please ask me simple ones though. Cover my shame.
Yeah. My alcohol is not too much today, so I will break it down. Okay. First, simple question. Easy. The most easiest question that we always ask on this podcast. What's the name of your president? The president of Nigeria. Emiloko. Okay.
It's my son. That's our president.
What's his full name?
Bola Ahmed Tinubu.
Hey, clockies. That's good. You got it. Okay. Our next question. What is the name of his vice president or our vice president of Nigeria?
Shetima or something like that. Shetima. But yeah, I don't know the other name. I just know it's Shetima. Anyway, you can help me add the first one there.
You know what's so funny? You know his middle name. You don't know his first or last name.
Oh, that's even his middle name? I tried. At least I know something. I know something. Yeah.
Yes. His name is.
And I know he's from the north, right? Yeah.
Yes. Borno State, I believe. He is Kashim Shettima Mustafa.
Oh.
Yeah, but wonderful. I mean, officially he goes by His Excellency Kashim Shettima. So, yeah.
Okay.
You got it. We're now going to move to states and capital. Don't worry, I'll not ask you the full 36. Not all of them. Oh, are you practicing?
Run it. Let's run it.
Where are you from? What state are you from?
I'm from Ogun State.
Okay, what's the capital of Ogun State?
Abeokuta.
Okay, you know what?
Abeokuta lawa.
Relax, don't worry. Okay, I'll be nice. What Give me the states and capitals for all the states starting with letter O.
Okay, I've given you Ogun
Ogun
State.
State.
So
Yeah.
Ondo, Akure, Osun, Oshogbo,
Uh-huh.
Oyo, Ibadan. Hmm.
Hey!
Which one again? Which one again? Which one again?
No, that's all. That's all the O's. Okay,
That's all.
that's all the O's. Letters like states that start from O, letter O. Let me
10
give you
over
another
10.
10 over 10. See, you were worried for nothing now. You were
No
worried for
buts.
a reason.
Let's go. We are ready.
Let me give you another one. States that start with the letter K.
Hey. KB. KB. KB
What's it?
is KB, abi.
No,
Bini
no, no.
KB, abi.
Say it. What did you say?
Bini KB.
Brini KB. Yes,
Bini
yes.
KB. I
Yeah.
got
Hey, you got to one. Let's go. You have a few more to go.
Kano. Ilorin. Wait. Mo fuck up. Wait, hold on. Kano. Kano. Kaduna. Mudaru. Wait. Kano is Kano now.
Kano is Kano.
Kaduna is Kaduna.
Is Kaduna?
Katsina.
Which one is Katsina?
Is Katsina not Katsina?
Hey! Clap for yourself. Clap for yourself. See, I mean,
My daddy's money did not waste. He
No
sent me
way.
to school. I passed through the school. The school did not just pass through
It
me.
did not just pass through you. You also passed through it. That's
I
what
waka pass.
you capas. That's perfect. Okay, let me find one other trivia for you because you are acing all this. You are saying no, be easy on me. Meanwhile, now you do you
Let me
just
sit majestically because I the ace.
ace them. Okay. Let me look for. Give me the first two lines of your national anthem.
Arise, compatriot, Nigeria's Colombia. Ena.
What is
Tusa,
what is
father's land.
what is this now? O for Odo. You don't know they changed your anthem?
Is that not the national anthem?
No, they changed it now.
Hey! Since when? Please, I'm Canadian now.
Since Emiloko stepped since Emiloko entered, it has no longer been Arise a Compatriot. It's
So what's this now?
Nigeria, we hail our own definitive land. That's the old one.
Oh.
The first one.
Oh. I'm Canadian, sorry.
Yes. Oh, my bad. I'm sorry. I apologize. For.
Please, don't ask me for don't ask me that one. I've given you the one you asked. Next question.
Okay, now no wahala. Let me ask you last one. Last one before maybe one riddle. So last one. No. What is the Nigeria like the motto of Nigeria? You know our coat of arms.
Yeah.
What they wrote on top of it, our motto.
Peace and unity. I'm busy on that one. Peace.
It's not just peace and unity. They write some other things there. There's peace and there's unity, but there's other things. So.
I told you I'm Canadian. That's all I can remember.
What is the Canadian?
Peace and unity. Of which one?
What is the motto of Canada?
Motto? I don't know which motto. GMC. Okay, that's American motto. Which one again? Which?
She said GMC. Okay, let's go back to the Nigerian one. Let me not stress you out too much. It's unity and faith, peace and progress. So that one I'll give you 50
Unity
because
and
God,
peace and progress.
yeah,
Oh,
yeah. She said,
how cute.
"Oh, how cute." How cute. It's actually very, very demure, very cute, very, you know. Thank you so much for answering all these questions. You did well, though. Clap for yourself. Let me spray you money.
My daddy is proud.
Very proud. Me, I'm proud because not a lot of people come here and ace it the way you did. So, we're done. Adjust your fila where. The brain is too hot. Oh my goodness. So, final question here that I'm gonna ask you is a riddle.
Mhm.
Okay. Are you ready? It's just one I'm asking you.
Mm.
What loses a head in the morning but gains one at night?
Pillow.
I got it! You got it! Oh, Jesus! You got
Wait,
it!
for real, I got it.
Yeah, you did, you did. You were quick too. You were like, I never even finished the question. You already talk pillow.
I just woke up now. I commuted for pillow. At night, I go put my head back. You know,
Wisdom.
God is
Huh?
good. You know,
God,
God gave me this brain. So,
He's working.
Abimbola, you know, tap it. Come, tap
Okay.
pillow. Tap pillow.
Oh my days.
Oh,
Thank
that
you.
was fun. That
That
was
was so much
fun. That was
fun, right? I
that was
love
fun.
doing this because it's a very good way for everybody to like relax.
That's fun. That's fun.
Yeah. So we're going to get into our conversation a bit more. We're going to start with you yourself. We've already established that you are from Nigeria, the alleged giant of Africa. And just give us a bit of a background of what your immigration journey was like, how long you stayed here, and what the gap that you saw that inspired you to create AfroCare Network. And then after that, I'll introduce you a bit more and we'll get into it.
Well, my journey. I've been here for almost 10 years, so I'm still going I'll soon be a decade in Canada. Yes, it's a long journey. I was just this pretty beautiful, intelligent Nigerian babe. I was working in Access Bank in Nigeria, and the opportunity came to come to Canada. With the
Mm,
support of my company, then, I was able to come to further my studies
mm,
in Canada, like HR. So I applied. Funny enough, I applied. The first time I applied, they denied me.
mm,
I'm a babe, I don't used to give up. So, I had to find, the reason why they denied, I had to work on that, and gather my documents again. So I applied again. And I'm so grateful for the school that I studied, which was Conestoga College. They were patient with me, like they even extended like when I was supposed to start, like my start date because of my visa application. So I reapplied, and this time, the second time, it was successful. So that was how I moved to Canada. The plan was to study HR, human resources, and go back to Access Bank, because I wanted to be in HR. I had this mentor. I think she's now the head of Access, but I used to look up to her a lot, and she was the head of HR back then. And I'm like, this woman, I want to be like her. You understand? So I wanted to study, further my education, and that was the plan. And when I got here, 1 year after the first year, I'm like, oh my, this place is good though. It doesn't look like I want to go back to to Nigeria. So that was how the journey started. I finished school, and I think my journey has been good, because before I even finished school, I already got a job position to work as HR recruitment coordinator, entry level. And I hadn't even graduated, but through like networking and some of my professors and friends back in Conestoga, I was able to, like, my resume was out there. We had a course where we had to work on our resumes and then we share. And then we had this capstone project that we would do where you have to support an organization in their HR process where there's a gap. So this particular organization had like onboarding gap. So that was what my project was, capstone. And from there, I got hired full time, and I started working for the organization back then. And I was with that organization for a while. When they talk about racism, when you come from a country where you are all the same, you don't really clock when, like, things like that do not bother you. So
Yeah.
coming to Canada, where it's a diverse community, it was really surprising. Like, there were some things I'll go through and I'm like, I don't think that's right. You get what I mean? And I've worked, I once had a boss that would call me Ebola as a joke because he couldn't pronounce Abimbola. That was how it started.
God.
So
No, you just say Ebola.
I'm telling you. And then when he did that, I was like, "Excuse me, do you know the meaning of it?" He said, "Yeah. Come see." He even showed me on his laptop. It's a disease in Africa. I'm like, "And you think it's okay?" It's a joke. You're too serious. So that was my first.
You're too serious.
I'm telling you. And then, I tried to take it up legally, but then I started getting like advice that, oh, you just came, this is your first job, you're already doing this, people, they can blacklist you. I got scared. I'll say my first 5 years in Canada, I operated from a place of fear because I'm in a new territory. I didn't come with my family or anybody. I came by myself with my 2 box, right? 1 box of shoe, 1 box of clothes. That's how I came. So I'm like, fashionista, it's still small, you understand?
Yes,
so I was like, I had nobody, and I was really trying not to get into trouble or my name to be there, like, in that spotlight. So there were a lot of things that I experienced that I just let go. Do you understand? So yeah, that was how my journey. From there, I did my PR. Then I got my citizenship. I became a citizen in 2022, I guess. Yes, I became a citizen in August 2022. And since then, the journey it's been pretty straightforward.
Yeah.
There were challenges, especially 2018, 2019, 2020. But my immigration journey it's been God, honestly. And the fact that I finished school, I had a good job, also, supported that process.
Right.
So it wasn't an easy journey, but at the end of the day, through like the right guidance and mentorship, I was able to navigate a whole lot. I had support, I'm not going to lie, from people that I don't even know. But they met me and they cared about me and they took care of me. Like, and I feel like it's only God, because I know that I'll always say, God, please, you said you give me helpers on my journey. You understand? So please help me. You understand? I always pray for that. And, God He did it, right? There were people that would come into my life and support me in ways that I never would have expected. And there's no way I can quantify it or just say it's God, because I'm not lucky. Anything that happens it's not just luck. Yes, there's a part of luck in it, but I believe it's God, because everything I do, I put Him in it. Like, I pray. I have these funny conversations with God. Like, God, this morning as I'm going out, don't let anything happen to me. Let me not fall down. That's how.
Absolutely.
Yeah. So it's been God. There were ups and downs, but my journey has been. I can't complain. I'll be ungrateful to complain.
Oh my dear, I hear you so much when you say that. See this, like, because I moved in like, about 2015 too for my master's program, so for school, and you have job right outside of school, all those things. Me where go study, I went to go and study creative arts, theater arts. I did not really know when I was in school that this is not a 9 to 5. It's not something you can just apply for. Like, there was a lot
Yeah.
of like unknowns because in art school you're taught about the arts. You get really good, you practice and all those
Mhm,
things. They don't really emphasize on the life of the artist and how you're self-employed, you're working on a contractual basis. You're like, so I really love hearing stories where people like you had people who were able to guide you and get you into, networking with the right people, working on the right things that kind of open doors for you. Like that is such a blessing. And I love hearing that. But I'm also
yeah.
very surprised that you work in human resources, and in human resources, you were facing those micro and macro aggressions, like those racist
Yeah.
like experiences.
I'm telling you, back then when I tell people, and people be like, "Well, you're HR, so you should know." I'm like, I know what to do, but I'm just this small girl that wants to fight big people.
Yeah,
Like the people that
but
were that were doing this to me were who like I don't want to give out too much
please
because
don't get no. We're
like
not trying to
uh,
call out anyone. We're not calling out anyone, right? We're just
yeah.
you're sharing your experience. So don't
Yeah,
feel
because in that job, I got to meet a lot of prominent people in that job because it was in security. And we used to work closely with the Toronto police, and that was when, I even had the opportunity to meet the chief of police back then. So I knew the people. So like for an organization that works with the kind of protege, those kind of people. It was, I can't, well, I'm just a small
I
kid in the hand of God. So, you have to pick your battle wisely. You
I
understand?
hear
And
yeah. I
yeah,
hear
that was what happened. And like I said, I was navigating from a place of fear because I didn't think, like, what would they say? What if they lie against me? They are, because they were saying, I told you I tried to take it up legally. It wasn't like they did that and I walked away. No, I tried, and the way they came back, and it was in the point where I had my first car accident and I was dealing with a lot of things. So it was too much, and I had to just pick which one. And my health was the most important thing. I was like, money comes and goes, but if I lose my life, that's the end. So I needed to focus on my health at that time. And I was like, you know, when karma is real, when the time comes,
yeah.
you understand.
Go back
But
around.
it was documented even legally, so it wasn't like I just gave up on it. But it was just that at that point, my health was more
More
important to me. I was
yeah.
fighting to stay alive. So their own, if you like, call me Ebola. That's not my case, but let me
Yeah.
stay alive first. So that
Yeah.
was, what really happened at that time. Yeah.
I appreciate you for sharing that, because the number of these stories that exist, especially with newer immigrants, you're fresh out of school, you're just trying to like make your mark and build, your resume, make money, like try to expand yourself and grow. And it's just so weird how these sneaky things just start happening and you're like, wait, what is, am I,
Mhm.
is this a dream? Like, is this
Is this
really happening?
is it
Like,
yeah.
you know what I mean? Like, if I were to turn around and call this person eczema, because white folks have eczema sometimes, like, I don't know. Like, if I was to turn around and call them that, how would they take it? You know what I mean? Like, it just, it breaks my heart,
And it
right?
was the time
I,
that, you hear stories of, it was like whatever. I don't want to say exactly they are white people, like, but a white person can say something about a black person and they'll believe them before the black person. So it was more
oh,
of, oh my God, I don't even know if they'll
you're a
believe
minority.
me, or I know
Yes.
I was part of the minority. You understand what I'm saying? So that's why I
Mm,
said I was operating from a place of fear. If I
yeah.
could go back, which I can't, I have no regrets, but if I could go back now that I have knowledge, I would have done things differently,
Yeah.
but it is what it is.
Yeah.
Sometimes
We live
things
and we
happen, you
learn.
learn from it and you move. You move.
Absolutely.
We keep
Absolutely.
it moving.
Forward, ahead. Focus.
Forward ever,
Focus
backward
on
never.
where we're going. Thank you, my friend, for sharing that. So let's just shift gears a little bit and talk about this beautiful platform that you have created, the AfroCare Support Network. Friends, if you're listening, AfroCare Support Network was created to fill a gap in services for Black people living with HIV and addressing sexual health. Too often, stigma, misinformation, and systemic barriers make it difficult for people to access care. So we step in. So AfroCare Support Network, they step in to provide education, financial literacy, peer and cultural relevant support. Like this, I have to say, like, first of all, if I was wearing a hat, I go offer for you. Like this is such an incredible, it's an incredible initiative. It's an incredible resource and platform that you've created, and a beautiful community. And I want to ask you more about it. Like, what inspired this on your journey? You move here, you're working in HR, you're, fighting your battles, choosing your battles, taking it every day at a time. Where did this idea come from? What was the inspiration for something like this?
So back then in Nigeria, right, before I came here, I used to volunteer, and I used to donate blood. So during that process, I used to volunteer like in hospitals, in Abeokuta back then, support. And that was how, it started. Like I got to know much about that, but there are some personal stories to it, but I also, apart from my own personal story, I also like through that volunteering and connecting, I met someone back then and she was HIV positive. She's dead now. So, may I sort of continue to rest in peace, but we're very close. We're really very good, close friends. And so, and because we shared, similarities, so it was easy to bond as friends. When I came to Canada and I started working in school, work, HR, and all of those things, I started sitting on the board of Black Cap, Toronto. That's Black Coalition for HIV Prevention in Toronto. And while I was on the board, they had, they support people living with HIV and any other STDPIs. They help you with your immigration process, anything like that. They help you with support, care, and all of those things. So I would always volunteer, and I started sitting on their board. And, from the HR perspective, that was how it started, right? Then they had a program. So they were running a program, and there was the question of, it's not just gay men that are affected by HIV. We have women affected by HIV. We have people in the queer communities affected by HIV. So they had programs for queers, children, youths, it was diverse. So, and I'm like, there was a gap, especially for the queer communities, right? And so while we were sharing ideas and talking about that, so I was like, so I brought up that yes, we have programs for men to men, we have programs for women, but there was no representation for like those in the queer LGBT community like that. So they got a funding for that project. After we spoke about it, they got a funding for that project. And I remember the director back then came to me and asked, do you want to run the program, since it was your idea? So that was how it started. So I had to step down because of conflict of interest. I had to step down from the board, and then I started working from them. And that was after, my accident, and it was COVID. So it was like a more of remote job. So I enjoyed it. So I would create programmings. I would create, I started the intergenerational chit chat, and I'm so grateful that they continued and kept on moving up with that. That's intergenerational chit chat was a program to to bridge the gap between like seniors living with HIV and youths, as in people's, like when you see someone in their 50s or 60s or 70s and they're living with HIV and they've told you that, or they've had it like maybe a decade ago or 20 years ago or 30 years ago, or since during the HIV/AIDS pandemic, and they are alive and they are well and they are doing well, it gives hope to those children, those young people that, they just got diagnosed or they just got to know their status. And it can be like, rather than, because HIV is a deadly disease, and most times even the fear of having it already scares people, not to now talk of when you have it. It's like a death sentence. Back then, that's how people would navigate it. Some people, you even hear people say, God forbid, I'll have HIV. And I'm like, there are people who have cancer, there are people who have diabetics. You understand what I'm saying? So I was like, so we would hear like stories of people that give up once they get diagnosed. They just feel like their life is over and they don't want to do anything. So we're like, okay, how can we, support people to feel like their life is not over? Let's bridge the gap. When we show them that there are people in their 70s that they've had it maybe for the past 50 years and they're still okay, that would, motivate them to not give up on themselves. And that was how the programming started. I created a program for Fife House also in Toronto back then. So I've always been in the community. Anybody that knows, like my friends from back in Toronto, I'm always like in the community, supporting, either volunteering, doing this or that. And I think that came from my dad, because he's a community person, he's a community man. Every Sunday in my house is full. You think we're having party? Do you understand? And I think I brought that energy to Canada, because even when I was in school in Kitchener, Conestoga, our house was the party house. Every Friday after school work, everybody come to my house. We are all having a good time. You understand? So I was always like, I like when people come together and we're all just having fun and having a good time, like black joy. You understand? So I that was how it started. So I'll always be in the community doing those type of work and all of that. Then I got the opportunity. I came to Calgary. I had a change, and I knew that I needed a change. So when I moved to Calgary in 2023, a lot of things happened and I'm grateful for the things that happened in that year between August 2023 to December 2023, because that was what pushed the start of AfroCare Support Network. First, when I got here, I wanted to continue in that light. But I saw that, yes, there are organizations out there that support people living with HIV, right? But in the Black community, it's different for us, because we already see sex as a taboo, even though everybody has it. You understand? So it wasn't like my dear. You see people popping out with bellies and babies, but they can't talk about sex. And I'm like, bro, you do it in the other room. So why? You understand? So it was always, the Black community is, unique when it comes to sexual education and talking about sexuality, HIV, all of those sexual education. And I was like, the programming these organizations have, it's not centered to culturally support Black people. They would not listen to you. And when I came, the things I'll hear is, because I went to SafeLink Alberta to even, go there, like, to be part of them and all of those things, to put back like into the community like I would do. Right. And they'll say, people don't come out, they don't come for meetings, they don't do this. Yes, because Black people will not come out for all those kind of things. There's a way you have to go about it for us to even come into a gathering where you are talking about HIV. You can't put it, this is an HIV initiative and people will come. They would not, because they don't want to be associated with it. Do you understand? So, and in that, through all of those, I met some amazing women who are living with. We sat on the round table, and I think it was maybe HIV Edmonton or Ribbon Rouge, one of those organizations. They were doing a survey. So they reached out to me because they knew about my work in Toronto, that, so we would all come together and do the work. And it was in that meeting that I met people that were also living with. And I'm like, okay, so how do you get support? We're talking, and we saw that there was a lot of gaps. And I'm like, okay, from my experience from Toronto, let's start something. Let's, you can't keep waiting for people to create space for you on the table. Bring your own table. Create your own table and bring your chairs to it. And that was how AfroCare Support Network started. So it started from networking people, because now there were a lot of people in isolation, to the point that even when people want to go to get their medication, like, because I did the work, I went to Satan Alberta clinic, to have conversations. with the people that, support people living with HIV. And, they told me the gaps, the things they see, especially in the Black community, like even when they come for their medication, they cover themselves up and all of those things, so they are not recognized. And all that says stigma, shame, stereotype. You understand what I mean?
Yeah.
And it was unfair. Like, nobody goes out with the intention of, oh, I want to go have sex or something and have HIV. Nobody does that. The kids that were born with HIV, what do you want them to do? The woman that got married to her husband as a virgin and never slept with anybody but is HIV positive, what is she like? Is it her fault? There are people that they got it from their boyfriends or their girlfriends, and the I don't know how to put it. So, like, the unfair part of it is a man that is HIV positive, can sleep with a woman one time and that woman can be positive, right? While a woman that is HIV positive can sleep with a man 5 times or 5 different men and none of them would be positive, right?
Are you for real?
Yeah, because we women, our cervix area, it's delicate, it's fragile. That's why even little infections, you can use the toilet, if it's a dirty toilet, you catch it. Now imagine the penetration of, so it's, a woman can have sex, and the man might not have it like immediately, like quickly.
Right. Yeah.
But the woman would, right? If she sleeps one time, you can have it. And that's why we always say, protect yourself, protect your body. And there are things out there right now. And, let's not deviate, because you said, how did I start it? So that was how it started. It was just a group of women that came together, and I could see their needs, their concern. It wasn't just about me or my story or the support of the program or my experience. It was also about their own lived experience also. So that was how it all came together and it started. So I was like, okay, there's a gap here. And we did the need analysis. So I started, it was self-funded. Everything, I put my money into it because I believed in it. Because I'm like, there is no organization in Calgary that is committed to Black people when it comes to HIV. You understand? There are good work to like Center for Sexuality, Freddie, Safe Link Alberta, all those organizations support people living with HIV, but there's no organization dedicated, to just Black people. And because our needs are different, because the stigma is different, the shame is different in the community, the cultural content is all different, so that was how that started. Giving them cultural support in terms of having conversations. When they see someone that looks like them, that is like the face of this thing that is wrong with them, it's easier for them to come to you and be like, this is my concern, this is my problem, help me. We come from a culture where close your mouth, don't tell anybody your problem outside. You understand? So now I'm now going to go and talk to even people. It's difficult to get them to see a therapist. Like, I'll go and tell a stranger what is wrong with me. You understand? And we have to change that mindset, So now you are telling me I should go to an organization that none of them there is, Black or something. You understand? No, I'm not going. So, and people were isolating. It was impacting their mental health, and you have to use medication, but your mental health is impacted. Good food, you have to eat good food for your medication to work well, and we found out like there are new immigrants, newly diagnosed people that would rather not talk about it, because of the shame, and they would just hide away, and things like that were happening. And that was how the birth of AfroCare started. And we had our first, when we had our launch, it was really huge. People were excited, and you don't know how many people that I got like calls from, emails to share their story, and to be like, thank you for starting something like this. I felt like, okay, God, all right, now I understand why all the troubles, all the pains, all the life lessons I've experienced, it was leading me right to this place. the
Yeah.
pain, the tears of 2023 because it wasn't just like starting with AfroCare. I was trying to start like a non-profit also with like some group of friends, but it didn't turn out the way it was supposed to turn out. So I had to remove myself from that because it was like, God revealed himself through me through someone, and there was a conversation and he said, that wasn't the path for you to go. Like your path was just to bring out the idea. It wasn't
Right.
for you to implement. Leave it. And this is your path. And so when I started the AfroCare and the messages I was getting, the conversations I was having, it kind of solidified that, yes, this is what I'm supposed to do. And I do not, and it's funny because when I started, people were like, oh, you're doing HIV. Are you HIV positive? Is that why? Because Nigerians believe that, if you are not aligned with something, why are you supporting it? I'm like, yes, now I'm HIV positive. What else remain? Everybody has
Yeah.
their HIV status. You're either positive or negative. If you
Mhm.
want to know my status, come to our program and education. Come and learn.
Come on
Because
here.
come and learn there.
Even
You
if
will
you
know
want to come for
about this.
gossip, just come and learn
Come,
something.
you will know there that if I'm HIV positive or not. You understand? And, even the fact that I just, represent and support these organizations, you hear talks here and there, whispers and all of those things. And it's like, I don't care. It's not a you die. I would not die. You understand? If you
Yeah.
think I have HIV positive, if you think I'm negative, you understand? But at the end of the day, I'm happy that this is where I am and this is what I'm doing.
I
So that
love
was
that.
how it started.
Thank you for sharing all that. You touched on so many things,
I
like from
know.
how your no, my dear, please. That's why we're here. From how your journey started in Toronto, back even in Nigeria, with donating blood, and
Mhm.
moving to Toronto. Like, shout out to you and like your passion for community and for service and for creating support and help in any way that you can. Like, I think that and you talked about your friend in Nigeria who was positive and who has passed on now. May her soul rest in peace. Like, and
Mhm.
how all of that kind of led into you joining this organization, supporting it, and then being on the board in Toronto. And then from there, moving to Calgary and the paths that led you, the research, you had a lead SWOT analysis. How did you say it? You did everything. You did your research, did the work, went around, went to different clinics, asked questions, and then you moved forward. You just did it. You
Yeah.
invested in it by yourself. Like, that talks about like such level of commission and dedication to the cause that it's not common. You'll be so
Mm-hmm.
surprised. People like, oh yeah, I have this idea. Oh, I see that people need, but tomorrow. But you went, you went in and you rolled up your sleeves and you got to work. And like, that just speaks of like a resilience and such empathy in your heart for people. So shout out to you, man. Like,
Thank
that's
you.
not something to be taken lightly. Like, we got to give you your flowers, my dear. Here you go.
And that friend, she didn't die of HIV yet. She died from the shame and the stigma of it. She could not. Like, it was, when someone would sit down and Yoruba would say, oh, me. She didn't think she could make it again in life. She saw it as a death sentence. And sometimes, what you think of yourself from inside, it will manifest outside. You understand? She thought that was the end of her. And it led to that being the end of her because she would not eat, she would not go out, she would not even want people to know she's on this medication, she would not want this. And because of that, it started adding up a lot of, medical issues that were comprising up, and she wasn't using her medication and mental, but we didn't know it was mental health because we don't know
Right.
mental health in
Nigeria.
Nigeria.
Yeah.
Understand? Her mental health was much more what killed her than the disease
And
itself.
I
Yeah.
think that I've seen one movie back then, old Nollywood, around like the early 2000s or middle 2000s, where Keten Shaw, Keten Shaw now, the actor,
Yes, sir.
he had HIV/AIDS, and just what you were saying, like she was fitting herself with like, oh, what people look like as the disease progresses, what their body looks like, how vulnerable they become, how they lose so much weight, their skin, this and that. And something that she had, like, even if the thing was, because I think it was a late diagnosis or something in the movie, so she was further gone than she realized. So she didn't have as much time, or the way the story she told the
Yeah.
but because she filled her mind with all that could go wrong, just like you were saying here, like that led to her demise way quicker, right? Before she knew it, what she was seeing on the screen was happening on her own skin, right? She wasn't taking her medication. She wasn't eating properly. She was not eating. And like it's a movie, we know, yeah, and she died at the end. Oh,
But
but this is
it's the
real
truth.
life.
That's what
It's
happens.
real life. Like that's what
Yeah.
happened. Just the story that you just shared, like
Yeah.
is so eye-opening, right? So I
Mm-hmm.
wanted to ask you, because like it's not easy serving community, especially Black communities in North America, period. And this is a network that you've created to support, whether you're African, Caribbean, it does not matter. If you're a Black individual living with this, here's some support, and that's what you're
Yes,
doing.
yes, yes.
And so I'm really curious about like what's like how you guys or how the organization addresses like stigma. You've talked a little bit about stigma. You've talked a little bit about misinformation. What are some of how how has the organization addressed stigma within our communities? Because Africans, Black people have pride. So when you were
Mm-hmm.
saying that, like people going for their medication, rapid, like covering their face, I was not surprised at all,
Mm-hmm.
because like, that's what happens even in like um oh my gosh, there's this place in Calgary downtown where there's like free food and free stuff that people can get when Black people do go. It's like they're covered because so people will now see me going to this shelter to collect food. Like there's this like the pride. Hey, will you eat your pride? You need food. Please go and collect food. And so how have
You
you?
can't blame them. It's not as if it's pride. We have to ask ourselves
It's
honest
more
questions.
nuanced than that. It's
It's
more
more,
nuanced,
yes. It's
right?
I don't think it's the pride of them, because you can imagine, even me as I am, I've sat in conversations where people will say, they'll be discussing, HIV, clinical, and someone will say, God forbid, what I don't know will not kill me. May God forbid. May I die before I have HIV. And you are sitting in those kind of things. Yes, you will hear things like that. So
May I
imagine if someone that
die?
is HIV positive, sitting maybe in the group of friends, everybody is just, and they are talking about the disease that you have in that light.
Like,
Even you yourself, you start believing what they are saying about, that. So
yeah.
it's how we've been addressing the stigma is we've been running programs, and the programs like events where we address like the community. Africans, we like vibe, we like fun, we like party. So yes, so that's how we address stigma at AfroCare. We bring you for the fun or for the party, but in those conversations, in that fun that we are having, we are discussing about HIV, and we are discussing, about the stigma attached to it. We are preaching about the message you equals you, because you equals you means once you are HIV positive and you are on the medication and you are adhering to your treatment and your care, we have things where like there's viral load, then there's like a CD4 count and all of this. And I can't go into the details of it. It would be like I'm talking jargons, but
Okay.
like you become undetectable. It means that if you go for testing, a blood work, it will show you that you are HIV positive, but it doesn't mean that the virus isn't, like, you actively have the virus and you can pass it to somebody else. You can't pass it to somebody else. So it's like, when someone says they have cancer and they are cancer free. Yes, they are cancer free, but they still have cancer, but it's just that, they don't just have cancer that is terminal that can kill them. That's why, sometimes they'll say it regenerates back, and they'll say,
Right.
oh, someone, yeah, exactly. So you are HIV positive, but you don't have that enough virus in you that is suppressed. that you can pass it to somebody else. So you equals you, which means undetectable equals untransmittable. So if you're undetected, you can't transmit it to somebody else. So is it not better for you to know your status and be undetectable so you don't pass it to people around your community than for you to not know and be passing it around? Because that's what we are seeing. There's high immigration rates in Calgary right now. People are moving in, right? And this has led to some people get to know about their status during immigration protests. They are newly diagnosed during that. You can imagine, so you're coming to a new country. As you're entering the country, you get to know you're HIV, positive. So now public health, shout out to public health. Public health takes up that responsibility, and they work together with IRCC, and so they would let you know and give you the resources, where to go to, who to talk to, what hospital to go on to. And that was how, we started. We partnered with Center for Newcomers. That was like our first programming ever, Center for Newcomers, for new immigrants that just came into the organization and they need support. And they are looking for people that look like them, that are living with the same thing, so that they can get that support. And that was how the organization, that's how we've been addressing the stigma. So we had, for example, in April or July, we had the Courage Unmasked event. So now, I'm not going to, if we are going to have a programming or an event, I'm not going to say, oh, you are invited to this HIV initiative. No, because I know if I post that, nobody's showing up. So I use things like Courage Unmasked, building strengths, things like that. Come join us for this thing. There'll be food, drinks, performance. Who doesn't like where there's free food and there's free drinks and there's Afro beats and I am coming to dance. I'm seeing people read poems and perform. People come, and it's open to the general public. You don't even just have to be in the Black community, just general public, because that's our programming. The only where we prioritize only Black people is where, we have program like support services. You understand? If last year we had like a food drive, culturally specific food. Like for other people, I'm not going to give them that. It's only Black people. Those are catered to. But when it comes to our events, it's open to the general public. Whether you are positive or you are not, or you are negative, or you are, come and learn. So that program, we played a movie. I can't remember the title now, but there was a movie we played. It's a movie based in South Africa, right? Of someone that had HIV and the stigma that they experienced. And I was so grateful for the turnout of that event, the interactive session. You had people standing up, asking questions, talking about, even me. Someone told me after this, I had to go back and how am I contributing to the shame and the stigma? I always use the Bible to support me, saying, that person has HIV. But I was so grateful that I was in that event because I learned a lot. Because we brought people that were living with and were open to talk about their experience. We brought medical professionals, whether medical counselors. We brought doctors, and in our panel discussions, we brought peer navigators so that people can talk from lived experience. And people in the audience, they were so receptive. We watched the movie. The movie was like an hour plus long. I was even scared that let's bring this into that people will not wait. And I was shocked that people sat down and finished the movie. And even after they finished the movie, they still did not go. People were talking, they were having conversations. One man stood up and said, when he was serving in the army of something, he was in this, they learned, as in people were talking, and I felt like, yes, it was such a success. I felt happy. And someone, one lady came to me and be like, I'm proud of you. I'm proud of this work that you are doing. Nobody wants to do this. And I look around and I'm seeing people talk openly about HIV. And I said, yes, I did that. Abimbola, give yourself high five. You did that. So
Yes.
You did that.
Hell yeah.
So and it's been a good journey. We just started. We are just like over a year, but I know that the possibilities are endless. I know
Endless.
that we are going. We've not received any funding. It's always still our
I
own
was
money, and
going to ask about
yeah,
that. Like,
no,
have
no,
you
no. I haven't received any government funding, any whatever fund. No, I've not. It's especially for it's health related, and most times, you know, as much as we want to, let's not lie to ourselves. That stigma, even within organizations, is still there. Some people tell you, oh, their funding is not directed to this kind of cost and all of those things and blah blah blah. But at the end of the day, as long as we are doing the work, I believe that the money will come. It's not
yeah.
the concern right now, it will come. You understand? When it comes, we'll be able to expand, our operation and our organization staffing, because right now we are volunteer run. Like every program, every event we've been doing has been amazing volunteers that believe in the cause and they show up. There are some that will say, "Oh, don't worry, I'll cook for you for this." There are some that say, "Oh, I'll bring drinks," and it's like, and that's why I know that it's God, because He said He will create helpers along the way to you guys, and that's just been happening, and
Yeah.
the money I make from my 9 to 5, sometimes after I've paid bills, I've done this, I feel, okay, AfroCare is part of my bill. So I book
Yeah.
AfroCare as part of, and how much I have to. And because of my experience and my knowledge, because I even have like certificates from like HIV prevention, HIV treatment. So it's not as if I just know about the thing.
Yeah. You're trained.
From CATSI organization, I'm trained. Thanks for the ACE programming I did. You are trained. I had a PDLI trained degree certification on this. So it's not
God.
just about meeting people. I have the certifications for all of this, right? So I would go to organizations like I partnered with End of Rainbow early last year, and I did a training for them on sexual education for the people in the community living with HIV. The organization was paid. I would say the organization, because that's what I do. I would go to these people, provide this service for them, and the money they will use to run the service, they'll pay us, so we'll do it. And then I put the money back into AfroCare. It's not mine. I put it back, so I go as the bill and pay it to AfroCare. So those type of money that I've been making from doing this workshop for different organizations on HIV AIDS is what I put back into the organization to run our programs.
Oh my gosh, like this is so amazing, man. Like you're trained, like this is not, oh, it's bad to treat people this way. No, you have data, you have statistics, you have training, you have backing, and coupled with your own, like your heart of service and leadership too. I think that it just is such a beautiful thing that you're doing. And I want to ask one more question before we round up.
Yes,
Have
ma'am.
you or has AfroCare experienced like systematic barriers and racism within healthcare for Black, African, and Caribbean communities? Like, have you met some systemic barriers that have just kind of been one of the things that obstacles that you're facing?
Yeah, there are system barriers. You just started, we don't know, your capabilities or what you do. You hear things like, oh, I've heard things like, oh, I'm doing this for monetary gains to try to make money for myself. And I'm like, of all things, I'll now go and put my face on the face of HIV because I want to make money. When I can go and do other things. This thing that carries so much shame, I'll go and put my
Yeah.
face as the face of it because of money. No, my God is the source of money. I shall never lack. Money goes and money comes. It flows. So don't forget it. It's not, and I don't blame them. I think it's from experience of other people that have tried to do things and how they've mismanaged funds and all of those things. You get what I mean? But at the end of the day, when you judge everybody by actions of other people, it impacts every one of us. So it's always there, and Canada is a polite country. So you are politely
declined.
the barriers are politely in place. The systemic racism are politely in place. So, all those kind of things that even you yourself is later you'll be thinking, but the way to be polite with you, you will not even know that you have been
It's racist. It will not clock immediately.
it will not clock immediately. So yeah, we have been experiencing that, and it's just I have this belief that if it is not you, somebody else will do it. Do you understand? So if I come to you and ask for money and you say no, I ask why, so that I can, next time I'm coming to ask, I know what to, how to package again. But I don't, the organizations we've partnered with, they've been very, very supportive. They've been supportive, but it's still there. The systemic barriers and the racism is still present. I'm not going to mention. I went to one organization and they both plainly told me they don't support anything HIV related. As in, because of no, we don't do it because of the stigma, the barriers, and all of those things. Things like that. You hear that.
Wait, that's so surprising. So does the stigma extend to the sponsor? Do they just assume the organization has AIDS? What's the thoughts behind it? I'm so confused.
I don't know. Some organizations don't want to associate with that, and they will tell you, like I said, it's not their policy or their manifesto or what they are doing, or that's the polite excuses they tell you. But they can't come out to say it because that's discrimination, and you could sue them for that. So there are ways that they use the sweet English to maneuver you. But at the end of the day, the God that started it, He will provide the resources. That's my belief.
Oh my goodness!
I'm just the vessel. I'm just
the hands and the feet.
I'm just the one that started it. It does not. If in the next 50 years my enemy die today, I live long, happy life, and I die, AfroCare will still be here. So I am just the vessel. It does not belong to. It's not mine. It's from the community. You understand? It's not mine. I am just the vessel God used to say, fine, start it. You understand? It doesn't mean it belongs to me. My board has the power to. If I'm not doing the right thing, they have the power to remove me and fling me away. So it's not. Even though I founded it, it's not mine. It's not in my. It's not in my name. It's not like I'm making anything from it. Do you understand? So at the end of the day, I know that we would do well. So
see, if you're listening, AfroCare Support Network, if you hear that they're working on anything, have an event, have anything going on, show up and support. Show up and learn wisdom.
Yeah, it's fun to come and have fun also,
Yeah, and eat. There's food.
And eat. Correct food though, not, correct jollof rice.
Correct jollof.
Correct jollof rice and peppered chicken, anything you want. Come to our event. We are trying. We are trying. You can imagine, and I'm just grateful because you can imagine what we've achieved with no formal funding right now. Imagine when we have that funding, we will expand. It will be huge. It will be big, and to cover the community and provide the support. Because what I would love to see is people living with, because it's not just about educating the general public, it's also catering to the people that are living with and providing that safe space for them. Like I would love to see, especially for new immigrants and newly diagnosed people, when they come to this country, it's not, if you want to rent an apartment, they say, bring this, bring that. Someone that just came, that does not have, and it's probably on social service. And then house rent, even the social service money they are getting is not enough to rent the house. You understand? And they still have to use medication. They still have to do this. They still have to do that. And that's why people are, because their brain is so worried on my health. Feeding, housing, it should be like the basic necessity that somebody has to worry about. I've met people living with in shelter that they have to be hiding their drugs so that other people in the shelter don't know that of their status, so they don't shame them. You understand? I would like to have like a community, like a house where people who don't have places to stay, that they maybe they are renting, they are not renting, they are staying, or when you are, what's that word? What's that English word I'm looking for? When you are staying with someone, it's not like you are paying there, but you are just
You're squatting.
yeah, that's squatting someone's basements just for the time till you find your bearing, but you have to hide, and because you don't feel safe to like create a safe space where even if it's subsidized housing for them to stay, at least if they have place they're putting their head at night to sleep peacefully and they feel safe and they're taking their medication, they can go out there and look for job.
Yeah, that's one less thing to worry about.
That's one less thing to worry about. Someone that is still looking for how to survive, where to sleep, what money, how to make money, how to start working. You understand? And then they now have to worry about where they are sleeping, what they are eating. It's a lot, especially the mental impact it has, even with your medication that you're taking. You understand? And then when you're on medication, it's good for you to like slow down, because so that medication can work well. It's no doctor would like to be adding more medications on top of your HIV medications, especially when it's like mental health this, because you have to compare the relationship between those medications. So if we can reduce that mental stress, the housing issues, the job issues, then it will be things will be better for people living with, and they'll be good citizens in the economy, and they'll make money for the city. You understand? But I'm still, even with no funding, I'm still grateful that at least we were able to get like jobs for like 5 people. They have full-time job now. So yes, I use my HR brain also to help them, screen their resume, prepare them for interviews, support them, be a reference, refer them to organizations that that will take, the type of job they are looking for. So yeah, 5 people this year, from last year to this year. And it's been amazing, and they are doing well in their job. So I'm so happy about that. One of them said, Miriam, do you know how long before you came to this country, I've been applying to this organization? I've been applying, always getting rejected. I just gave you my resume, you submitted on my behalf. I'm working here. And I'm like, it's not me. I am just a vessel. It is not me. I am just so, things like that are what makes me go to bed. Even if life is doing me gbas every day, things like that are what makes me go to bed and sleep well at night. I'm like, thank you, God. I did something today. I made an impact today, and I'm happy about that. So, yeah.
I think that's incredible, Miriam. How can people find you? Please share your website, social media, anything, email, whatever. We'll put it all on the screen.
Yeah, so for social media, it's AfroCare Support Network everywhere. Twitter, Instagram, Facebook. Our websites, also it's www.afrocaresupportnetwork.com. Email info@afrocaresupportnetwork.com. We have a dedicated line for people living with. If you need support and you are calling, you need someone to talk to, the number is 403-830-1278.
Hey, you had it here first. Maybe not first, because she's everywhere, as has been established. And I know y'all just had an event a couple of weeks ago, and the turnout on social media, it was so amazing.
It was World AIDS Day, and the old medical director of Southern Alberta Clinic was on our panel. And I was so proud. Yes, that's what I'm talking about.
But that's amazing, right?
Dedicators, yes, that's very amazing. Having, the person that directs the organization or the health system that people go for support to come and tell us what they are seeing from their end and to talk to the community. And it was amazing. It was beautiful.
Yes.
I'm proud of the work that we are doing. So
I'm proud of y'all too. Hey, if there's any way Afros in the Diaspora can support, we'll be more than happy to. Like you, we are also volunteer run and volunteer led.
don't worry,
So
we'll
we're
get
getting there. We're getting there. Funding and everything is coming, so
God's
we're not going to
grace.
worry about it. But
God
I
does not
mean,
leave his own behind.
period and
That's
per. Period and per. But thank you so much, Miriam. You have shared so much about your story, but also about AfroCare Support Network, the amazing, amazing, amazing work that you're doing. Are you guys open for donations? Like, if people watch this or listen or whatever, are people like? Is there a way people can donate? Is it
yes.
a charitable organization? How can people donate?
Yeah, so in terms of donation, we love donations. It could be monetary, it could be in kind. You know, if you hear that we are having any events, any way you can support us, we appreciate that. It's also like you can always, when you check on our website, there's a donate link right there. You can e-transfer, you can use PayPal to donate. We have the link, it's up in our website. The donate box is there in our website. But if you prefer e-transfer, our email is, you can either send it to accounting@afrocaresupportnetwork.com.
That's awesome. So y'all have heard it. Please donate, please support. No dollar sign is too small or too much. If it is in
Yes.
your heart to drop 10,000 at once, just do it.
We'll do good work. And it's not just, how people can support. You can also donate your time by
Yeah.
volunteering. We need that more, Please come join. You don't have to be HIV positive to volunteer or to support. You can sit on our board. You can be an ally. We are looking for professionals that can sit on our board, either legal, like lawyers, communication, marketing specialists, HR supports, finance. We need all of those time donation also, in terms of volunteering, even for our programming, are you good with photography? Please support us, donate your time and your resources. Those are the things that, we would appreciate also.
Yes. So not just money, but time, effort, energy, expertise, donate. AfroCare Network is open and welcoming to anyone who wants to donate their time. But also, if you or someone you know is living with HIV, there is a dedicated phone number that, like Miriam just shared. Please give them a call if you need someone to talk to, if you need support, if you need to just figure life out. Like, there is help. There are resources in the city. There are, support networks like AfroCare here.
Yes.
Reach out, call. You're not alone. You are not alone. I know
Yeah.
it's such an isolating thing where it's like, because people see HIV, they show for face, so it does not show on the face. So everyone is just
And
trying
now,
to,
that the medication has advanced, because it's even, we have injectables now. It's not sure.
yeah.
You can see the freshest person and
But again, it doesn't show on the face doesn't mean that if you need the support, you shouldn't go find it. It's
yes,
there, it's
absolutely.
available, it's in community. That's one amazing thing about living in Canada. There's so many resources, and African Support Network is one of these resources, one of these organizations. Even if you are like, I want to reach out, but I don't know, somebody may hear my phone call, send them a DM. Send them a DM.
I'll
Start
send a
from
text
there. Send a text. Oh yeah, you can also send a text to the phone number.
to the
Send
phone
a
number.
text.
The text.
Just get in touch, and so that you can be supported in all the ways that you need it. Once again, Miriam, this has been amazing. Thank you so much for your time. Thank you for sharing about yourself and about this amazing organization that you have created. We look
Thank you
forward
for
to,
having me.
of course, we look forward to all that you're doing in the community. And my dear, this has been awesome.
Gracias.
Gracias.
Obrigado.
Obrigado. Okay. For our listeners, we'll see you on the next episode. Thank you for listening this far with us. Feel free to like, comment, share, leave your thoughts in the comments, share this information with people that you know who need the support. Okay. Till next time. Bye.
Plug Sarah.
Okay. Bye.